Hello, friends. Happy afternoon, happy Monday, and happy April. I am coming to you live again to talk about one of the other topics I mentioned in the last live last Monday. So if you didn't catch that one, we talked about cesarean sections. No, I'm sorry. We talked about incontinence. The next one's going to be cesarean sections. Oh my gosh, I just confused myself. Okay, so the last one was cesarean section. Today we're talking about diastasis recti. Next time we'll talk about incontinence. I'm all confused. So, diastasis. Do you have a separation in your abdominal wall? Some people aren't quite sure what it's called, but it's called diastasis recti. The abdominis, rectus abdominis is your front layer of your abdominals, the superficial top layer of your abdominals, also referred to as your six-pack abs. And these muscles, your abdominal muscles, get stretched during pregnancy. And sometimes there can be a separation in the abdominal wall. So when you have these six-pack muscles, you'll notice, if you've ever seen a picture of abdominal muscles, that there's this white film in between the muscles, each side of the muscle. Well, that fascia layer can separate during pregnancy. And I remember the first time that I saw it was my very first Pilates instructor, the person who trained me to be a Pilates instructor, and she was a mom, and I want to say she had at least one at the time, maybe two kids, and her abdominal wall separated during pregnancy. And when she rounded forward as if to do a crunch-like position, you could see what was underneath, her insides kind of pushed out, so it created this bulge in her abdominals. I don't remember what she said at the time about what she wanted to do about it, or what she could do about it, but over time, as I've learned by practicing or teaching Pilates and working with women, is that Pilates is, of course, Pilates for the win for everything. Pilates is fantastic for helping eliminate, decrease, if not eliminate, the separation in the abdominal wall. I've seen a few clients, and we've seen it happen, and I've had some OBs in the area refer their patients to me to help their patients decrease the separation of the abdominal wall. I've heard women say, I've lost all my baby weight, but I have this diastasis, and I still look 3 months pregnant or 5 months pregnant, and they just are not happy with it, which is, it can be understandable. I mean, you're not expecting any longer, and why would you want to look that way? Some women don't want to look that way anymore. So what can you do about it? I've heard some of my clients say that they've been told surgery is the only way to fix it. I can't imagine having a surgery with that, but like I said, I've seen women decrease it in the studio by coming in regularly and practicing simple Pilates exercises, simple Pilates breathing techniques. One thing you want to avoid when you do have a separation in your abdominal wall is that forward crunching motion, because it will exacerbate it. It just pushes forward anything underneath and pushes it forward against that separation, which causes it to go bigger. I've seen the separation as high up, just right under the chest here. I've seen it just above the belly button. I've also seen it right below the belly button. When we're pregnant, our abdominal walls are stretched already. So which causes a weakness. So that weakness in our abdominals, like I mentioned in the last video about cesarean sections, when we have an abdominal weakness, it can cause back pain, it can cause neck pain, it can create poor posture, it can have, different effects on the rest of the body. So when you have a separation in your abdominal wall, yes, your abs are weak because they are separated and they're not able to connect like you once did before you were pregnant, and when you were pregnant, or before you were pregnant. So with this diastasis, or with this separation in the abdominal wall, like I said, you can do simple exercises for it, breathing techniques. If this is something that you are experiencing and you would like to work on or have questions about, please feel free to leave questions here in the comments or send me a message, personal message. I'm happy to answer questions via personal messages. I've also written about this and on the blog, so if you go to youneedtherhappy.com, therhappy, THERHAPPY.com, you'll find the blog, and there are a few resources there with exercises, how to strengthen it, and some information about how to strengthen it as well. And then if you go to a YouTube channel, there are also videos there that you can use to practice. But if you need more focused attention on your diastasis, if it's a big problem for you, if it's really bothering you and you have questions and you really want to work on it, I'm here to help you. Whether you live locally, you can come into the studio, or if you don't live locally and you want to work online, I do work virtually with people through live video, whether it's FaceTime or Skype or another platform. And that's all I have to say about that as far as diastasis. If you have questions, like I said, please send them my way. And don't be afraid to get help for it. Okay, have a great day. Bye-bye.